Hey, hey everyone, it's Naomi Wolf of Daily Clout, and I'm so honored and thrilled to be welcoming Dr. Vatsal Thakkar. Thank you so much, Dr. Thakkar.
Thank you. It's great to talk.
So we're honored to have Dr. Thakkar here. He's a board-certified psychiatrist. He's also founder and chief medical officer of Reimbursify, which is a startup that helps you with your medical insurance, as I understand it, and financing. And he has a decade-long background in academic medicine, both at NYU and at Vanderbilt. So not only that, but his work on vitamin D, which is specifically why I wanted to speak to him today, has been featured in the Wall Street Journal and the New York Times, and he's written an open letter with 150 other doctors from around the world to inform and educate healthcare leaders and policymakers about vitamin D. And he's part of a kind of campaign, Vitamin D for All. And specifically, he's been working on vitamin D and coronavirus disparities. So such an important healthcare professional, distinguished psychiatrist and healthcare practitioner, who's here with us today, and I want to ask you basically in a nutshell, Dr. Thakkar, what about vitamin D? Let's start with that.
Sure. No, thank you, Naomi, for this conversation. So there's millions of people around the country and around the world who've been told that they have a vitamin D deficiency, and this has gone on for 10 years or more. And it's something that people have kind of, casually neglected, or it's been a bothersome nuisance, that, oh yeah, I have to take my vitamin D supplements. Why is that important this year? This year, it seems like vitamin D deficiency can be fatal. And the reason is there's a unique convergence of ill effects from this novel coronavirus that the world is struggling through and vitamin D deficiency. And one new publication that I just co-authored this month in MedPage Today, it was co-authored with a former Surgeon General, Richard Carmona, titled, "Don't Let Your COVID Patients Die of Vitamin D Deficiency." So there's been, at this point, dozens of studies, over 50 studies, most of them correlational, but some of them are actually showing intervention helps, so that suggesting that increasing your vitamin D level typically by supplementing, taking an oral supplement every day, helps you not only protect against getting infected. A study in JAMA said it reduces your likelihood of getting infected on the order of 70%. It also, if you do catch the virus, it seems to help protect against ill effects, meaning ICU admission, ARDS, which is acute respiratory distress syndrome, cytokine storm, which is a massive inflammatory response that is responsible for a lot of illness and death, and ultimately mortality rates.
Well, let me just jump in there, Dr. Thakkar. That's pretty mind-blowing. These are not fringe publications. JAMA is the Journal of the American Medical Association. Yeah. It's one of the premier peer-reviewed journals for those of us who are not medical practitioners. And these are not like marginal results. You're saying a peer-reviewed study, a published study, has found a 70% drop in risk of catching coronavirus if you're taking vitamin D supplements orally. Is that correct?
So they looked at a retrospective over the last year. If someone had their vitamin D level tested, and they were positive for coronavirus. So what they saw is that if their vitamin D levels were sufficient, over a group, I believe it was 400 or 500 individuals, the rate of positive testing was much lower than if their vitamin D level was low. And another similar study tested 200,000 blood samples at Quest Diagnostics and found a similar, decreasing levels means increasing vitamin D positivity rates.
So this is what you mean by it was a correlation. We don't have a smoking gun that says these people took vitamin D or their levels were high, therefore they were at lower risk for catching coronavirus. What we found with gigantic random samples, right, is that
Correct.
people who had high levels of vitamin D were less likely to be positive for coronavirus. Is that the right way to say it?
Correct. And there are now intervention studies that show similar results that I'm happy to share. So, one of the adages, when I first started talking about this back in April, I published in the Wall Street Journal, and I would agree at that point in time, we didn't have enough data to say for sure. I was publishing a strong theory. Mm-hmm. As I watched the data come in and the pandemic unfold over the summer and the fall and now the winter, more and more correlational data came out, but interventional data started coming out as well.
Can you explain the difference between correlational and interventional for those English major finalists?
Absolutely. So, correlation does not equal causation is often taught to medical professionals and scientists to not get overly excited about a correlation, right? So a correlation could be, on a cloudy day, I have more pain in my knees, right? But maybe on a cloudy day, I'm less active, and therefore I have more pain in my knees, and that has less to do with the cloudy day.
So correlation is things happening at the same time that may not be caused by each other.
Exactly. So we always need to dive deeper when there's correlation. And one thing you can do with correlational studies is have many of them looking at the same issue from different angles.
Right.
So we have repeatability, right? We have dozens of correlational studies that point in the same direction.
Really? So by now, there are dozens of peer-reviewed studies that show a correlation between high vitamin D levels and low COVID infections. Is that fair to say?
Either that or low vitamin D levels and very severe COVID infections.
Wow.
Yes.
And more severe outcomes if people are infected, like more likelihood of cytokine storms, more likelihood of hospitalization if their vitamin D levels are low?
Absolutely. And this has been replicated in Mexico, Iran, Spain, Germany, U.S., multiple countries around the world.
Gotcha. So go ahead. And now you have a causative study. You have an inferential study. Is that what you called it?
An intervention study. So the best way to test a correlation is, okay, well, let's actually randomize people and intervene.
Right.
So let's find who's vitamin D deficient, and let's give them vitamin D to fix their levels, to normalize their blood levels. And at the same time, keep a group as a control group. So we give them placebo and compare the two, right? That's the best way. And that's how the foundation of medicine is built, upon randomized controlled, placebo-controlled trials.
Right.
So the first one that really cemented this, in my opinion, cemented this correlation into place was out of Spain. And what they did, every patient that was admitted to the hospital, they decided to give a high-dose vitamin D supplement. And now this is a region of Spain where the average blood level is 16 nanograms per milliliter. The normal range is 30 to 100.
Oh, wow.
So by definition, people in this region are deficient. And they gave a super high dose, it's a pharmaceutical grade, highly potent vitamin D analog called calcifediol. And what they found was, it's a small study, and I admit that limitation, which people point out. However, it caused an over 90% reduction in people being admitted to the ICU. So you had that got calcifediol, and only 2% of them were admitted to the ICU, and the ones who didn't, 50% of them were admitted to the ICU.
You could not have better scientific structure for an experiment, is what I'm hearing. It's randomized, it's controlled, and one group got a placebo, and the group that didn't get a placebo, that got the vitamin D, high-grade pharmaceutical-grade vitamin D, had a dramatically lower rate of going to the ICU. Is that a correct way to say it?
Correct. And then about a month later, another study came out of India where they gave people, they didn't have the high-grade pharmaceuticals, so they gave people high-dose standard vitamin D that you would find in a drugstore. So they gave they gave people, it was a liquid form, they gave people 60,000 international units per day for 7 days. Mm-hmm. So they gave, over the course of a week, they gave people 420,000 units. Now, the U.S. recommended daily intake is between 400 and 800 international units per day. And
very high.
This is a sidebar, but that's been recognized as being too low for many years by the experts. Because, for example, if you sit for an hour at the beach on a summer day, you would generate 20,000 units of vitamin D just naturally from your skin.
Gotcha.
And in this study in India, these were mildly symptomatic people. And what they found was it caused the people who got the vitamin D cleared the virus within 2 weeks. So within 2 weeks, they tested negative.
Oh my gosh. 3
times the rate of the people who got the placebo.
That's amazing.
And in addition, they found that there was the levels of fibrinogen, which is a blood clotting factor. And one of the complications in COVID-19 is that people have a hypercoagulable state. So they throw blood clots, and they didn't, early on, we didn't know why people are having strokes or heart attacks. And it's because of the fact that the blood clotting system blood gets thicker, if you will. Fibrinogen is a factor that causes the blood to clot more frequently. And they also found that the vitamin D group had much lower levels of fibrinogen than the people who got placebo.
Wow. Extraordinary. So did any of the people who got vitamin D go to the ICU?
In that study, that they selected a group of people who were both vitamin D deficient and had mild symptoms of COVID.
Gotcha.
Whereas the Spanish study was hospital admission, so it was on the more severe end of the spectrum. The Indian study was on the milder end of the spectrum.
But no Indian study got much sicker and sent to the ICU. They cleared the virus within 2 weeks. That's correct. Unbelievable. Well, isn't this, I want to hear more, but just from what you've told me already, isn't it kind of criminal negligence that we're not giving people pharmaceutical grade vitamin D the minute they get to the hospital, certainly, if not the minute they test positive?
This is one reason this has become sort of a very passionate endeavor for me and a handful of others around the world, is to get this word out and get as many people to know about it as possible, because it seems like policymakers and health authorities around the world are not taking notice of this.
So tell me, are there any other important studies I need to know about the efficacy of vitamin D in fighting COVID before I go on to ask you about policy?
There was a third study out of Brazil. It's not peer-reviewed yet. And I mentioned this in the op-ed I co-authored with Surgeon General Carmona, which did not find an effect of supplementing with vitamin D. We identified problems with that study, 2 problems. One was that they were giving one dose of 200,000 units, and we feel that a higher dose spread over many more days is more effective. And there's a delay in giving that dose after the symptoms started, as well as the fact that everyone's BMI the average BMI in that study was 31, so obese. And one thing that people should know about vitamin D mechanics is that the heavier you are, the more vitamin D you need, because it's fat soluble and the fat cells suck it up, and there's less available for your other organs.
So they weren't perhaps prescribing the right vitamin D levels for basically the size of the patients in that study.
Not enough and not fast enough.
Can I ask you, so now can I ask some lay people follow-up questions about what you've shared with me already?
Sure.
Well, the first is, I've started reading the peer-reviewed literature about coronavirus, and that's kind of a dangerous thing to do, because you quickly find that the dominant discourse about this pandemic doesn't really match the peer-reviewed studies, and often the peer-reviewed studies are misreported. So one of the things I found right away is that the highest correlation for your risk for coronavirus, in addition to age, is obesity. So I guess one of my first questions is, could the fact that obese people need more vitamin D be one of the reasons obese people are at special risk for coronavirus, that maybe their vitamin D levels are lower?
That's certainly one, definitely one correlation. And some of these correlational studies have actually factored, adjusted for diabetes, hypertension, obesity, so that the vitamin D signal is still present as a factor. But there's no, I don't think it's a coincidence that the people who have been most affected by COVID-19 are people who are overweight, obese, people with dark skin because they have a harder time making vitamin D from sunlight, and the elderly whose natural vitamin D production goes down with age.
This is hugely important. I mean, I'm literally getting chills listening to you because it makes so much sense. Let me go on and tease this out a little bit. In the 19th century, like I'm reading up, brushing off my 19th century kind of therapeutics, and sunlight and fresh air were often used in treating patients, especially with respiratory diseases like tuberculosis and so on. And invalids were often told to take the air or go to a sunnier climate. And I know that there are many peer-reviewed studies linking vitamin D levels, sunshine, to immunity. Having said this, isn't it possible that the fact that coronavirus infections drop in the summertime related to the fact that people are outside getting vitamin D?
I certainly think that's a strong correlation. And let's keep in mind that there are other benefits of sunlight besides vitamin D that seem to help, that could be helping diminish coronavirus infections. For example, nitric oxide is released from our skin, and it's a natural antibacterial, antiviral molecule. I've been trying to, myself and others have been trying to get the word out, like late summer, early fall, that, this is going to change in the next few months if we're right, because sunlight's going to go away, and vitamin D production is going to fall, and cases are going to go up, and hospital admissions are going to go up, and mortality rate's going to go up. And I read headlines all the time like mortality rate's the same as it was last April. So we haven't learned anything. So we have to challenge all of our assumptions.
And so let's tease this out even further. If sunlight elicits vitamin D and other positive responses, but let's just focus on vitamin D for the purposes of this interview, would that possibly explain why sunnier climates like Africa is having less of a hit from coronavirus, and Northern Europe, Canada are having very bad outcomes with coronavirus? Would that be one causative factor?
That's another piece of this puzzle that we're building, explaining how sunlight and vitamin D interacts with this unique coronavirus. So some of those correlational papers looked at mortality rates based on latitude, and there's a direct correlation between, the further a country is from the equator in general, the worse the mortality rates are from COVID-19. And this was true in the pandemic of 1918.
Wow.
Connecticut had mortality rates 4 times higher than Texas.
Wow.
And back then there was, there was no disparity in health care because there was no health care. So, we have to learn from the past as well.
So basically the advice of 19th century doctors with infectious diseases that they couldn't yet cure to their patients to leave dark, cold, damp climates and go to sunnier climates was not stupid. There may have been some basis in fact there, if indeed vitamin D has this protective effect.
Absolutely. And I joked with someone the other day that during the pandemic, it's safer to be poor and black in Africa than an educated brown or black doctor in England. And I said that because in March and April of last year, scores of dark-skinned doctors died in England. And this has been theorized to be because they have low vitamin D levels and they're above the 37th parallel, which is known for vitamin D deficiency in dark-skinned people. So
this is also quite chilling what you're describing, because much has been made, and in the United States much has rightly been written about the disproportionate impact of coronavirus serious illness and death on communities of color, it's been largely theorized that virtually all of that is due to illnesses of poverty and stress of being a person of color in America. But what you're saying means that we should also look at a practical matter that darker skinned people have more difficulty creating vitamin D in their bodies, right? And that has to be adjusted for. Is that what you're saying? And
absolutely, yeah, absolutely. I don't ignore the fact that health disparities exist and access to healthcare exists and disparities exist, and that, you know, if you have darker skin, you're perhaps more likely to be an essential worker in a service industry. All of those things are true, which hurts your chances of, you know, against COVID-19. But we're seeing, you know, if we're seeing 3 times the mortality rate between light-skinned and dark-skinned people from coronavirus, there has to be something else to explain that, because we don't see that level of disparity against, you know, for strokes or heart attacks, right? If this was all access to healthcare or discrimination in healthcare settings, you know, it just doesn't make sense.
And are there studies proving that darker-skinned people create vitamin D differently as a result of the melanin in their skin? Like, is this conjecture? Is it documented?
No, this is documented because you know, studies have been done. If you expose people with different skin tones to the same amount of UV light, the amount of vitamin D that's generated decreases as the skin gets darker.
Wow.
And
so,
for example, in the United States, the average vitamin D level for someone with dark brown or black skin is around 16, again, which is deficient. And the average for people with light skin is 26. So a 10-point difference. Now, wow. All of these studies that show people do poorly with COVID study people with a level below 20. So you see right there that, you know, we have a disparity in biology right there, that, you know, why are people with dark skin averaging deficiency levels compared to others?
So if what you're saying is true, and so far you've given me nothing but peer-reviewed data, surely, and it's not your job to make public policy, but surely it's extremely negligent not to immediately send out a public health message to support people with darker skin getting access to the vitamin D they need to make up for the deficiency that they're likely to have as a result of having darker skin. Is that correct?
Right. I totally agree. But I think during this pandemic, I think everyone needs to pay attention, because a level of 26, you know, for example, I don't know if you know your level, but
I don't.
You know, when I checked my level. Funny story. 10 years ago, I asked my doctor to check a level of vitamin D, and he kind of brushed it off and talked me out of it, because he thought, you know, if it ain't broke, don't fix it if you don't have any symptoms of anything. And so I ordered my own level. And this was, I live in the Northeast, and I have brown skin, and I thought I might be a little bit low, but I'd be fine. And my level was 11,
wow,
which is considered severely deficient.
Right.
And this was in a summertime level, you know, after spending a week at the beach. And so I was really shocked about that. I've been supplementing ever since. My level's now around 50. And it takes 10 times the U.S. recommended daily allowance to get me up to a level of 50.
Wow.
So
let me put my question another way then. Sorry
sure.
to interrupt. Basically, we're putting communities of color at risk by not making this information more widely available.
Yes. But during the pandemic, I would say everyone, no matter what your skin color, needs to take more vitamin D. And part of this project, the Vitamin D for All project, is 200. It's now 200 international scientists have signed on that everyone should take much higher than the recommended allowances around the world.
Right.
Most of us recommend 4,000 international units daily,
right.
No matter, you know, where you live or what your skin tone. And every medical society has said 4,000 a day is safe to do without medical supervision.
So let me get to that letter in just a minute. Did I interrupt you earlier? Was there something you wanted to say when I cut in just now?
I don't think so.
You got it? Well,
Yeah.
Let me now go to my last policy question, then I'll ask you about the letter. all over the world, but especially in Northern Europe and North America, where we, of whatever skin tone, are at risk from the gray skies you see behind me and lack of sunlight in wintertime, people are being told to stay indoors. And in fact, to my dismay, there are countries much more restrictive than the United States. In Britain, I just got off a call with a member of parliament who said that it's illegal to go out for more than an hour a day for exercise, and other restrictions. And this is true in the Philippines. I have a colleague in the Philippines, and they're given tickets to go outside every other day, only for essential items, and children under 19 are not allowed outside at all. So it's happening around the world. And elderly people, I talked to a Canadian chiropodist, and she said that when an elderly patient of hers chooses to go to a shop or go visit the foot doctor, that patient, if they live in a care home, is locked in a room for 14 days after that. So we're seeing this around the world. I mean, I know college students who are being quarantined on campus and kept indoors. They're allowed out for 1 hour a day. They're not being told, go walk by yourselves for 5 hours a day, get as much sunlight as you can, be outside all you can, take your classes outside, have a distanced picnic with your friends. No, they're being told to stay inside. So given what you're saying, isn't this extremely dangerous advice and policy?
It absolutely is. It's revealing certainly a blind spot in traditional medicine and health policy. Now the UK did ultimately relent and is recommending people supplement with vitamin D, and they're even sending out free supplements to those in need, but they're recommending the same dose that they recommended, for the last few years, which is only 400 units a day, which doesn't even help in the winter, let alone in the summer, let alone in the winter.
Right. So you'd say that's a tenth of what's needed.
Absolutely. And you can just look at the 200 signatories on our open letter. We take, everyone lists their own personal dose, and we take between 2,000 and 10,000 units a day.
Wow. So now tell me about the letter. You said when I looked on your website, it said 150 doctors have signed an open letter, and now it's over 200. Who are these doctors? What are they saying? What should people know about this letter?
So most of these doctors are medical doctors. Most are professors at various academic institutions. We have several epidemiologists. We have several critical care specialists. We have several infectious disease specialists, endocrinologists.
What sort of institutions, if you don't mind dropping some names?
Sure. We have someone affiliated with Harvard. We have all the big institutions, and it's international, right? So it's Europe and the U.S. We're continuing to get more names on this letter to get more attention to it. But the hindrance has not been institution. The hindrance has been letting go of formerly acknowledged biases in medicine and not looking at our current situation and the current studies. For example, doctors tell me all the time, well, vitamin D's let me down before, so I don't want to get too excited about this. But we have to look at separate data differently. I agree that vitamin D had mixed results because we tried to test it against dozens of things in the past. But if you look at vitamin D, how it interacts with COVID-19 and this novel coronavirus, it's indisputable. And this is how, I had conversations with a former Surgeon General, Richard Carmona, and he looked at the data and he suggested we write something together to this effect. So I believe if someone sits down and just pays attention to this, it's indisputable.
Have you written that? Is that the letter, or is there a separate article that puts together all this data?
That's the letter has a lot of the data in it. It's a 2-page letter at vitamindforall.org. My op-ed with Richard Carmona, former Surgeon General, and John Umhow, who's a 20-year retired U.S. Public Health Service scientist, is on MedPage Today. And basically, we're in the thick of it, and we should be aggressively treating vitamin D deficiency for any patient in the hospital yesterday. It's not being done. Exactly.
any patient with coronavirus. Fantastic. Well, I'll definitely link to your article, and people can find out more by going to the vitamindforall.org website. Is that the best place to learn more about this campaign? Last thoughts. You've been so generous with your time. Well, I assume you're not having a lot of mainstream media pickup, because I haven't read this incredibly important set of arguments and presentation of evidence in the news feeds I follow, and it should be front page news everywhere, of course. I can't help thinking cynically, as a former political consultant, that vitamin D is cheap and sunshine is free. And here's a huge disease that a lot of big sectors are making a ton of money on. Do you think one reason, I mean, it's not your job to speculate, but why the resistance to covering this cheap and free solution or support coronavirus patients?
I think certainly, if this was a pharmaceutical, this would definitely be on every front page of every newspaper. It'd be on the evening news, and the more money organizations have, the more they can get their message out, for sure. But I think people and even doctors are biased. Studies have shown that if you give someone a more expensive placebo, they get better results than a cheaper placebo. So we are biased to think that the more expensive or intricate a solution is, the better it is. And that's certainly not the case. And if you just you make up a name of a drug and substitute that for vitamin D, when you read all these studies and see how, that would probably change more hearts.
I understand. Well, we'll do everything we can to get your message out. If you could wave a magic wand and change government policy in the light of this discovery of the importance of vitamin D and sunlight, what would you change? Like, would you tell people to go outside? Would you tell people to take vitamin D every day? What would be your 3-point guidance?
Right. Well, going outside right now isn't that effective, especially if you live north of Tennessee. And so I would say everyone should not only use masks and other preventive measures, but everyone should supplement with vitamin D, 4,000 units a day. And I would advocate for any hospitalized patient to get aggressive vitamin D supplementation if they're deficient, because the data looks amazingly clear that that's helpful in decreasing ICU and death rates.
Fantastic. Dr. Thakkar, thank you so much for your generosity in explaining this. Profile and Courage. You're number 9 in our series, Stepping Forward. And I'm going to say, by extension, the other 150, 200 signatories of your letter. It's very, very important. People will be able to read the letter in the blog we're going to post. They'll be able to read your presentation of your material. And lastly, if they want to support you, they should go to vitamindforall.org or any other website.
vitamindforall.org, spread it on social media. I also put a vitamin D calculator on my website so people can figure out the exact dose that they should take, and that's at vatsalthakkar.com.
Fantastic. Thank you so much, Dr. Thakkar. Thanks for your courage and your expertise, and thank your colleagues by extension as well.
Thank you for having me.
Take care.